Your nails can reveal problems with your lungs, liver, heart, thyroid, or even skin cancer. Today, I will tell you about 5 nail changes you should never ignore. Some are harmless, others need medical attention immediately. If your nails curve upward like a spoon, this is called Koilonychia. And the commonest cause is iron deficiency. Iron helps your cells grow normally. When iron levels become low, your nails become thin and weak. Over time, it bends upward instead of remaining flat. And sometimes it's the first sign of iron deficiency, even before you feel tired. And the next change could be an early sign of skin cancer, and many people mistake it for a simple injury. If you notice a new black or brown line running from the base of your nail to the tip, don't ignore it. It could be a harmless mold, old blood from an injury, but in rare cases, it could be a melanoma, a dangerous form of skin cancer. Melanoma develops when pigment producing cells grow uncontrollably. If the line is getting wider, changing shape, or extending onto the skin, go and see a dermatologist as soon as possible. If your fingertips are becoming larger or more rounded, or the nails are curving downward, this is called clubbing. It can happen with lung disease, heart disease, bowel disease, or sometimes even lung cancer. With these conditions, certain growth factors reach the nail in increased amounts, causing the fingertips and nails to enlarge over time. When I look at Leukonychia, the medical term for white spots or lines on your nails, the first thing I try to determine is where that white color is actually coming from. There are generally 3 causes. In true Leukonychia, the problem is in the nail itself. The nail matrix, where your nail is actually made, gets damaged or stressed. Instead of growing out clear, the cells become abnormally packed with tiny granules that scatter light, so the nail appears white. And the most common culprit behind this is minor daily trauma like aggressive manicure, nail biting, and tight-fitting shoes. In apparent leukonychia, the nail is normal, but the problem is below the nail. The nail bed is either swollen or has compressed blood vessels, so it appears white instead of pink. If all your nails turn white, it often points towards an underlying internal issue, like liver disease, kidney disease, heart issue, or low protein levels. In pseudoleukonychia, the nail is again normal, but the problem is on the surface. External factors like harsh nail polish remover, nail glues, and superficial fungal infections can cause tiny white spots to appear on the nail. And there is a test which can let you know which kind of leukonychia you actually have. If the white spot moves as your nail grows, it's just a surface issue. But if it stays perfectly still or fades when you press down on your nail, it's time to have a doctor check your internal health. The final sign is one almost everyone has seen, but many keep treating it as a cosmetic problem. If your nails start becoming thick, yellow, brittle, and start breaking apart, the most common cause is a fungal infection. Fungus grows under the nail where it's warm and moist, and as it multiplies, it slowly destroys the nail from underneath. The nail becomes thick because the extra keratin builds up. But you have to remember that not every yellow nail is a fungal infection. Psoriasis, eczema, repeated trauma, and aging can look very similar, for which people waste months using antifungal creams that never work. Your nails are sometimes the first place your body shows sign of disease. So if you notice a new nail change that doesn't go away, don't just ignore it or cover it with nail polish. Get it checked. It could help diagnose a medical condition much earlier. If you learned something new today, leave a comment and subscribe for more such videos where we try to separate myths from medical facts.